Good morning, it's Laura here from Your Last Resort Home Organization and Staging, and it's Friday, so it means I'm back again with another video. And today is a really important topic, and we're going to be talking about medicine and our medicine cabinets and getting ourselves organized from a health perspective as well. So I'm really excited today to have with me local pharmacist Margaret McLean. We're just rearranging here the camera so we can
get closer.
Gotta get close, cozy up. So this is Margaret McLean, and I have known Margaret probably most of my entire life from growing up in Port Williams together. So Margaret, as I said, is a pharmacist in the area and is an expert on all of this stuff, and we've just had a little off-camera chat to kind of talk about what we're going to talk about, and the information is really interesting, and I think it's going to be really helpful. So I guess, do you want to talk about anything about your background? I didn't ask you that. You're a pharmacist. How long have you been a pharmacist?
You're going to make me
you might
date myself.
Age. A while?
A very long time.
Okay.
Yes.
Okay,
Yeah, no,
we'll leave it there. I'll leave it there.
Yeah, I've been practicing pharmacy since, I guess, 1994.
Okay.
So, yeah.
We won't do that.
Yeah.
Okay. So we're just kind of gonna have a casual conversation and cover some really important topics as well. So the very first thing I guess we're gonna talk about is what to do with expired medicine, and I am totally guilty of this.
Yep.
Yeah, I was showing, you got me. And Margaret, I was showing her this morning. I brought two things that I found in my medicine cabinet this morning, and one has expired in 2014, and this one has expired in 2015, and they have been in my medicine cabinet taking up lots of space, like big containers. So my question is, Margaret, what do we do with expired medicine, and how do we deal with that?
All right. So, first of all, expired medications, you shouldn't take them. Unfortunately, that's our recommendation. If you have expired meds, they should be disposed of, and the best way to dispose of that is bring them back to your pharmacy, and we will gladly take those at no cost. So we're going to talk about that for a sec, and I'm old, I have to wear glasses.
Yeah, because I want to know how should I bring them back, and how do you want them back?
No, for sure. So I think it's a good idea, at least yearly, to go through your medicine cabinet and get rid of all the stuff that has expired, but also taking a look at your medications that are in there that maybe you're not on anymore. Sometimes medications get discontinued by your doctor, and you come to your pharmacy with your new prescription, and we say, oh, you're not on this medication anymore. Will you be sure not to take it? Maybe bring it back to us and we'll dispose of it. And sometimes it doesn't come back, and that runs the risk of you taking it again, which then increase the risk of drug-drug interactions, or then maybe taking too much. So it's a really good idea, like if even a medication that's been discontinued, that you bring it back to us as well. And checking your OTC medications, your over-the-counter medications, your cough and colds, like you've done your herbal medications here today, checking your creams, your polysporin creams, and those, and your sunscreen.
We were talking about that. I'm very guilty of that. I've got a lot of sunscreen because I'm like, oh, it's expensive and it's expired, but I'm going to still use it. But you're saying that's bad.
Yeah, it's probably not a good idea to use expired sunscreen either. I mean, you're using it to protect your skin, so let's make sure we've got the best chance of having that protection there. And sometimes it settles out, and so unless you're like, you might be taking the top part doesn't have like the good sunscreen portion on it. So it's not a good idea to use expired anything.
Okay, because I've heard a lot of people say, oh, you've got expired drugs, just flush them down the toilet. But you're saying no.
No, don't do that. I mean, that's not good for our environment, and especially where the pharmacies do take your medications back at no cost. We really would like to see them come back to us. So let's talk about how we like them to come back.
Yes, please.
So you can bring them back all in their original containers. That's no problem, but it does add a step for us, as we were talking about earlier. Because of confidentiality of your personal information, we're really careful with that stuff. So if you bring them back in the original containers, it is a step that we have to remove that label and put it in our shred, because we don't want your personal information getting out there. So that does add a step. So if you really want to be helpful, even just getting, like Laura's got one here, her largest container, she could just open that up and dump everything into this container, and then we will gladly take it and put it in for destruction. We have a couple things that we will ask you when you come in. We'll ask you, is there any sharps in there?
Oh, right. Right,
Yeah.
because you had an incident, yeah.
Yeah, we did have an incident where one of our care team did get pricked by a needle being in here. So we would like you to not put needles or anything in this sort of thing, because sometimes you can have like a relative that comes for a visit and they could be an insulin diabetic and you don't know what to do with the needles, and so maybe you end up putting them in a pop bottle or something. No pharmacy will take those sharps from you in that container. You need to go by your pharmacy and get what's called a sharps container. So this is a sharps container.
I've seen those lots of places.
Yeah, you put your needles in here. You must seal it. It must come back to the pharmacy sealed, and we actually ask for them to be in a bag. And if you bring them back like this and set them on the counter, we will then ask you to put it into a bag, because this is biohazard waste and we have to be very careful when handling it. So again, no charge. No charge.
Free service.
Free service.
To be safe.
Yeah, to be safe, and definitely want sharps to come back into that. And the other one is narcotics. We've got a big push on trying to make sure unused narcotics come back to your pharmacy for destruction. And it's a good idea for those to come back, because you don't want to leave narcotics in your home, because you're putting yourself at risk, unfortunately, in this day and age.
For your own personal safety.
Right, it is a concern. So bringing back unused narcotics in their original containers to us, because we actually dispose of those in another manner. We denature them so that they can never make it to the street, even through the destruction process. We handle those when we're at the store. So it's really important that we get the narcotics in the original containers, your sharps in a sharps container, and your medications either in a grouped in a big bottle or either in the original bottles. We'll handle them that way.
So when we were talking about sunscreen being expired and your polysporin, that can just go in the garbage? Is that
no, you can send those back to the pharmacy too.
Me too.
Yep, we'll take care of those. And you know how sometimes some medications, like for instance the birth control pills, are in those little punch out.
Yes, the foil packs. Yeah,
leave them in the foil packs. We just take them and they just stay in the foil packs when we destroy them. So you don't even punch those out.
Okay.
Yeah, just
makes it really easy.
Yeah, there's no reason. There's no reason. Just bring them back.
There's no reason not to. Say it's a free
Exactly.
service, and you're not talking just at your own pharmacy. You're talking any pharmacy.
All pharmacies. Yeah.
All pharmacies do that. So that's a great service. And
Yeah.
again, as I say, I had these two big bottles in my medicine cabinet, and they're quite big, and kept thinking. They take up a lot of space, so by going through, we're also creating more space in our medicine cabinets and getting organized,
which is nice.
which is what we love.
Yeah.
So so that is talking about the expiry dates and the importance of that. So what do we want to talk about next?
Well, why don't we talk about next how to store your medications?
Yeah, because
you're all about getting neat and everything.
Neat and tidy, and we were just talking about the number of people when we go over and the medications are all over the kitchen counter or on the bathroom counter. So I want to talk about that. Tell me.
So one thing we would always say, if there's ever children in the area, away from the reach of children is key. Storing your medication in its original container. We had talked about this. Pharmacists cringe when you come to the counter and you've got all your pills in the same bottle and you kind of shake it out and say, I want a refill on the pink one. We're like, oh,
what's the pink one?
Well, just have your medications, keep them in their original containers. Because, if something ever happened to you, it's a way of people knowing what medications you're on because they're in their original containers. So keep them in their original containers. We want to see it stored in a dry, away from heat and humidity. So back in the day, we all had the medicine cabinets and
I still have one in my bathroom. Very similar.
Open it. The bathroom's not the best spot to store your medications because it is a humid environment. Better nowadays with the air exchange and stuff like that, but I would think the best spot would be on your main floor. So maybe even in your downstairs bathroom if you felt like you wanted them not in your kitchen. But your kitchen's okay as long as it's not like next to the stove. And in a cabinet or in a drawer, I would think if you had a nice Tupperware type of plastic container and they were all in there and you could bring them out and have them access that way would be a good idea. Some people like to put them on their window ledges.
Oh, right. Yeah.
Not a good idea. The sun beats on them, which is not good. And then this time of year, if that's a moist environment, it can be cool in there. So don't really encourage you to keep them on your window ledge either. So that would be another key thing. But
so we're talking in a container. Actually, my parents do this. I'm telling on them. It's a good thing though. They have a nice little mesh basket that they bought at the dollar store with all the medicines in there, and just keep it in the cupboard in the kitchen.
Right.
So it is off the counter and away.
No, for sure. So that would be. I think that's about it with the.
Yeah. So because you can be on a lot of medications, and we were talking about that. So there's a couple of ways that a pharmacy can also help you be organized with all of the things that you are on from, we're talking about pill packs and
so for sure, you know, I think it's really important that you're armed with the information about what medications you're on, and being informed and part of, you know, your own health. So
I think these days too, there's such an emphasis on being an advocate for your own health too,
Absolutely.
that you need to be on top of what your situation is. So this is all adds to it.
Yeah. So something that you can do to help arm yourself with that information is pharmacies do what's called a basic or an advanced med review. And I encourage you to utilize this service. There is a fee for it, and you could discuss with your pharmacy as to what that fee is. But basically, a basic med review would take about 15 to 30 minutes. We print off all the medications that you're on. We sit down with you, and we go down the list looking for therapeutic appropriateness of it, so that you have a understanding of why you're on it, and also maybe any potential side effects. It's a time for us to kind of do a check system to make sure what you're on at home is driving with what we have on your profile at the pharmacy. And so that's really important because we want both things to be, you know, the same. And so it just takes a couple minutes. It's just a time for us to check our system to make sure it matches what you're taking.
I think that's great too, because you often think, oh, you have to do that with your family doctor, and it can be hard to get in to see your doctor, but you have those skills and that ability to be able to do that. So we just use your as a resource.
Right. So it only takes a couple minutes, and then the advanced one would be one if you weren't feeling well and you were having side effects, or you were on a lot of medications and you were wondering, can I get off of any of these? An advanced one would be one where a pharmacist ahead of time would go over all the medications that you're on, and gain knowledge about them, and seeing their appropriateness, seeing if there's any duplication of medications, possible side effects, anything that was missing within your regime. So then when you went in to see the pharmacist, that might be an hour to an hour and a half that you would sit with them. In depth. It's definitely a more in-depth one. Yep. And once you were done that process, it's really a good time for you to ask questions and have that one-on-one time with your pharmacist. And if after that there was anything that they felt like the doctor should know about, the pharmacist would actually
contact the doctor.
Their doctor.
That's helpful.
And then you would get a copy of it as well, so then you could make an appointment with your physician and sit down.
And so I don't have to remember everything that you had said to do.
And you sit down and go over it. So it's a good way of just cleaning things up. Like I said, it's usually covered by a lot of people's drug plans, and especially our pharmacare patients, and a lot of them are reaching their copay maxes right now. So, and they're generally on a lot of medication. So even just doing a basic one, just to make sure that what we have on is what you're on, and so I encourage, like, that's a good way to clean up stuff. The other thing we were talking about was autofill. So this is really nice. So if you're on a chronic medication, a medication that you know you're on like all the time, especially a good one to use, for instance, would be like a birth control pill.
Okay, or I'm on Synthroid for my thyroid.
Synthroid's another very good one.
One pill I have to take every day for the rest of my life. So,
right. Yeah, exactly. So do you get a 90 days supply of it?
Yeah, and then I get
with refills. Yeah, so she gets a 90-day supply. So it helps us too, because it helps us with our workflow. So what happens is Laura would come in. She gets her Synthroid filled. We would fill it. It would go to packaging. Then from packaging, it goes to pharmacist verification, and then it gets binned. And then it would either email, text, or phone her and tell her, hey, Laura, your medication is ready for pickup.
Yes.
And so then she would go and she would pick it up. And if she has refills remaining, the computer would then queue it 84 days out, because we usually fill them 86 to 7 days early so that we have that time to get it prepared.
Because
for
it
you.
takes me a few days to get down there to actually
Yeah,
to
well,
get it.
exactly. But it also helps us with our workflow
Yeah.
because then you're not standing there going, I need that in like
Yeah.
20 minutes. So,
Yeah.
so that works out well. So it's called autofill, and it just
Then
kinda,
you don't have to remember to get it refilled. And
right.
then
As long
to-
as you have
Yep.
refills remaining,
Yep.
it just kind of keeps chugging along, and that's a really nice program. The other thing is you were saying your
Yeah,
parents,
my parents use
and
this
my
too.
mom uses one of these. So kind of. This one particularly just has the days of the week, but you can actually get them with like times, like
Longer, bigger.
longer ones that have actually
detailed.
the times on them. But you put your pills in here, and it's a way of visually seeing that you took them. And then the nice thing about this, instead of having bottles all over the place, you could actually have these sitting on your counter. That's less cumbersome. And then the next one, if I was on a lot of pills, I think I would probably do this.
This sounds like a great.
Yeah. So this is
Yeah.
what we call pill pack. Some stores will charge for this and some don't, but this is a pill pack. Basically, you receive 4 cards, which have
4 of these sets.
4 of these sets, so it's enough for 28 days. And it has all your pills for a week's worth. So it has, going down the side here, it has the days of the week, and then going across, it has the times. And we make these for you. So we actually take all your pills and individually put them into these bubble packs, and then you just push them out as you take them.
That is a great service.
Yeah, and if you have refills, we automatically do them up so that, again, you don't have to worry about calling the pharmacy and having to wait for them. If you have refills, we do them. On this side would have like the names of the medications that you're on and stuff like that. So this is called Pill Pack, and it's really good if you're on a lot of medications. Like I said, I think I would probably use this.
Yeah, it's kind of like a no-brainer. I just know, and
Yeah,
you know
well,
if you haven't taken it too.
Yeah,
So
exactly.
yeah.
And when you first start out on this, we ask for the cards to come back, and it gives us an opportunity to see how you're making out with it. Because you'd be surprised, they still come back sometimes with pills still in them and
okay.
stuff. So it's a nice way for us to see how you're making out too. But that's definitely a great way to keep people organized and
keep your medicines under
Yeah,
control and
yeah.
make sure you're taking the right things.
yeah, no, for sure.
Yeah.
For sure.
Let's talk about travel. I mean, we talked about sunscreen already, but
Mm-hmm.
there's other aspects of travel that a pharmacy can help you with too.
For sure. Obviously, immunization is a big one.
So do you have the list of the countries that you need to take what for where to go?
No, I
Is
think
that-
we would use a website
Yeah.
for that.
So you would look that up. If
Yeah.
I came in and said, I'm going here, what do I need?
Yes,
Yeah.
we could definitely
Yep.
help you with that. And there is a travel clinic. I think there's one in the city where you could actually make an appointment, and there's a fee for it, and they go over where you're going, and they can do the immunizations right there. And there's like a fee for the whole thing. Your physician certainly is able to do everything as well. The big thing is don't come in 3 weeks, a month before you're leaving and needing immunizations, because chances are you're not going to be able to get them all in. So 6 weeks would be the absolute minimum that you'd want to start your immunization process. I would argue 6 months, or even if you're sitting there going and thinking in a year or two, I could see myself going to Cuba or the DR or something, then, get your immunizations done.
Because you say
Yeah.
those don't, I don't know, it don't expire in your body.
Right. No, like,
Yeah.
if you get the Twin Rex, you're good for like a number of years. I mean, you may need a booster quite far down the road, but it wouldn't be one that you would need in the next 10 years. So,
Okay.
yeah.
So plan ahead, go in and talk to your pharmacist and have them help you get
exactly.
ready for what you,
I know.
where you're going to travel.
For sure.
Yeah.
For sure. Yeah. And the other one was the flu shot.
Shots, yeah.
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 If you haven't gotten your flu shot, I encourage you to go get it. You don't want to get this flu. It's for a sore arm and, a headache and kind of achy all over. It would be much better than having to deal with the flu. And we were talking about how back in 2009 or 7, we had the H1N1 scare and had that mass immunization. I kind of still hear people say, well, I got that one. Well, if you got that one, then why aren't you getting your flu shot every year? Because this year, H1N1 strain, not that one that we did then, but
Yep.
another strain of it, is actually in the flu shot. And that's the culprit that seems to be hitting our areas. And it's definitely running havoc with the young people and children. So, definitely encourage everybody to get their flu shot. You can go to your physician to get it. You can go to your pharmacies. There's no charge to get your flu shot. So, If you come to a pharmacy, you need to be able to stay for 15 minutes after you get it, and we need access to your arm. But definitely encourage everybody to get their flu shots.
You said there still are a few available.
Yeah, definitely the doses are getting less available, but so you may go to a pharmacy and they may say they don't have it, but you can find one that
go
does.
around.
But yeah, ASAP on that.
Awesome.
Yeah,
good stuff. Okay, so then just basically just for keeping our own home medicine cabinets organized, we talked about going through and getting rid of anything that's expired, that's taking up extra space, keeping things off your counters and out of humid places or the heat up from the kitchen. Any other like tips for storing medicine or keeping on track of?
I guess just being proactive about it. Just taking responsibility for it, and I think keeping it in a cool, dry spot, and just getting medications that you're not on anymore also out of your home,
out of your house.
I think that was
so you don't get confused or keep yourself personally safe as well. I was talking to a woman yesterday, and she said something that her husband did just as a funny little tip, and I thought, that's actually kind of interesting. She was talking about how her husband goes in and opens the boxes of Band-Aids and makes sure that the boxes of Band-Aids are actually open in his medicine cabinet, because he says, if I'm bleeding and somebody's cut, I don't want to have to spend time to open up the box.
Oh my gosh, I love it.
I love it. I was like, that is so cute, and it's so
cute.
easy and safe.
I love it.
So he said make sure all your boxes of Band-Aids are open. So I thought that was funny. I had to share that.
One.
Yeah, exactly.
That's a good
one. Can you think of anything else that we haven't covered, Margaret?
No, I think
that's pretty informative. It's so awesome. As I say, our pharmacists are a great resource, and we need to remember that too. That that you are there and available, accessible, and it's easy. And I say, oftentimes a lot easier than trying to get into your family doctor, where you can help us with so many of these things. With ourselves, we're still young, and but we do have parents that are aging as well that we can help with. We may have to manage their medications as well, and so it's good just to be on top of
advocates for them as well.
Exactly. So just be good to be armed with all this information.
Yeah.
So my last question is that I didn't warn you about, but that I like to ask everybody that I'm here, because our business is called Your Last Resort, and our intention is helping people to turn their homes into a resort, into a space that's peaceful and calm. What do you like to do, Margaret, at home as your relaxation? What's your resort moment at home?
I would say a cup of tea. Right now, the fire.
Sitting by the fire,
having a nice cup of tea. Yeah, definitely love that. And then when the good weather's out, we're golfers. So for me, I would say I would be like, if I have time, even just to go to the driving range or whatever, it would definitely be hitting the golf course and being with my friends and my family.
Awesome. Yeah, Margaret's children are champion golfers, literally champion golfers. So
they're doing pretty well.
They are amazing kids. So that's basically wraps us up for today. So I just want to say a huge thank you to Margaret. You did awesome.
Thank you. And thank you to Laura for everything she does in our community. You reach so many people, and you're inspirational. And when you asked me, I thought, I can't say no for all the stuff you do.
I appreciate that. Thank you so much. So next week, we're actually going to be talking on Saturday, not on Friday, because we're going to be doing a road trip next week and visiting somebody who has an amazingly organized craft room, a sewing room. So we're going to be doing that next Saturday for a road trip. And so don't look for us Friday, look for us next Saturday. And if you do need some help and getting yourself organized and getting your cabinets and want some extra advice, we are here at yourlastresort.ca or on Facebook under Your Last Resort, and we are happy to help and come for a free consultation and give you some ideas of where to go forward. So
I might use her.
We are happy to help anybody, and there is no judgment, and it's all confidential. So thank you very much for tuning in today, and if you found this information helpful and useful like I have, I hope that you'll share it and pass on the word, and we'll see you next week. Thanks very much.